Instead, I'd like to move on to our third speaker today, our final speaker, who is Eric Hansen, Vice President of Government Relations at US Travel, where he leads development of US Travel's domestic policy agenda and represents the travel community before the US Executive Branch and Congress. And he's also worked, I know, as a legislative aide on the House Transportation and Infrastructure Committee. Eric, very much looking forward to your perspective on the impact of travel restrictions on the travel industry and what we should be doing next. So over to you.
Thank you so much, Mark. It's really great to be a part of this panel. And as soon as I can share my screen here, I'm going to pull up a slideshow for our presentation today. So just a moment here. I did get this right before. And okay, here we go. This is while I'm getting this teed up, this is one reason why restoring in-person meetings is so critical. So that we don't have to deal with technological challenges that are caused by things like Zoom. But we have figured it out here, so thank you for your patience. First, the U.S. Travel Association is an umbrella organization for America's travel and tourism industry. So we represent hotels, car rental companies, airlines, cruise ships, theme parks, and more. And with such a broad membership, we have a simple mission, which is to increase travel to and within the United States. And it almost goes without saying that mission has been challenged more than any other time in the industry's history. And the reason we're so excited to be a part of this panel today is that it's clear that vaccine verification is going to be one tool, not the only tool, but one tool for bringing travel back. So first, just to set the stage for context of why this is so important, we brought some economic data on how far the travel industry fell in 2020 and how far we have to go to recover. The U.S. lost $500 billion in travel spending in 2020, which generated economic loss of total output of $1.1 trillion. And I think the real and sad impact of that was that there was a loss of 11 million American jobs. Just to put that into context, more than 1 in 3 jobs that were lost during the pandemic were in the leisure and hospitality sector. And in fact, 65% of the travel workforce was reduced at the height of the pandemic. So the economic losses were catastrophic. International travel declines were a huge part of that. The first few months of 2020 were not bad. It's why we actually wound up down about 75% for the year on international travel. But really, international travel bottomed out in April and didn't improve much throughout the rest of the year. You can see that it declined by 96%, eventually got to 83% down. But international travel is actually still down to the United States around these same levels. And it's because we have continued challenges with border restrictions and concerns about safety of travel as a result of the pandemic. So just to give you a sense of how severe the international travel losses are compared to other sectors, this is an economic forecast for recovery. And you can see that for domestic travel, we expect spending and travel volumes to resume around the 2023 timeframe. Now, domestic leisure travel is actually largely back to where it was pre-pandemic, but business travel is really what's driving that extended recovery timeline for overall domestic travel, and that's going to take some time to recover. But international travel is by far the sector that will take the longest to return to pre-pandemic levels. And in fact, our forecasts show that travel volumes and spending won't resume until about 2024 or 2025 to pre-pandemic levels. So it's again, without question that we have a long way to go. And in fact, I think even this timeline for recovery is uncertain if we're not able to reopen our borders soon. The U.S. actually still has travel restrictions on the majority of the top 10 inbound markets to the United States. So you can see here Brazil, China, the EU Schengen area. I know this was covered in previous presentations, but I think the main point here is that many of these travel restrictions were put in place at a different time in the pandemic. Where a lot of the countries on this list actually now have higher vaccination rates or similar vaccination rates to the United States, including Canada, countries in the EU, and the UK. So I think the main point here is that once restrictions are put in place, politically, they can be very difficult to remove. And I think that's something that we're going to be challenged with, not only with border restrictions, but it's an important point to keep in mind for vaccine requirements as well. The loss of these continued restrictions is still here. For just the EU, the UK, and Canada alone, continued border closures cost $1.5 billion in lost spending each week in the United States, which is enough to support 10,000 American jobs. So I think there are other countries around the world that have looked at the economic cost of their border restrictions. They've actually decided to act. And there are many places throughout the globe now that are actually allowing fully vaccinated Americans to come back and visit their countries. And we brought up just a couple of headlines. Just this week, the UK began to allow fully vaccinated Americans to return. On Monday, Canada will reopen the land border to fully vaccinated Americans. And this is all despite the fact that the United States is still not allowing fully vaccinated individuals from those countries to travel here. So that is the challenge I think that we're faced with. That is one of the real causes of economic devastation, continued economic devastation. And while we know that data and science should lead the way for safely reopening, I think an important point is that it's not rocket science to figure out how to reopen safely. And again, many countries are already moving forward. But the United States has still not put forward a specific plan, timeline, or benchmarks to ease entry restrictions. And so this is the main thing that we're focused on now. In fact, more than 30 organizations came together from across the travel, tourism, and aviation space to recommend a high-level risk-based blueprint for reopening international travel to the United States, which made a couple key recommendations. First was to reserve entry restrictions for only the highest risk countries, where the prevalence of variants of concern that could undermine the efficacy of the vaccine would require border closures to slow the spread. But for all other low to medium risk countries, put in a risk-based framework that looks at the risk of an individual country, but also the risk of a traveler. And for low to medium risk countries to allow vaccinated individuals to enter the United States, to have a pre-departure testing requirement or proof of recovery, and to use that as the framework for reopening. I think over the past several weeks, there has been a large trend within the United States really focused on vaccine requirements and verification in a number of areas, including for employment, whether it's been city government or even tighter restrictions on federal employees. As was brought up earlier, New York City is now requiring some proof of vaccination for indoor activities such as dining. We're seeing the same thing happening in Denver. I think that same trend is going to happen in the United States for international travel as well. And in fact, just last night, the White House made comments to a few reporters that the administration is considering a global vaccine requirement for international travel to the United States, and that they're trying to determine not only the operational aspects of that, but when that system could be phased in and put in place. So I think that only reinforces, again, the importance of vaccine verification as a tool for reopening. But there are three things I think I want to leave this group with. One is that while there's increased focus on tying economic activity to vaccine verification, that vaccine verification is the best tool for ensuring safe travel, but it's not the only tool. I think if the United States were to require vaccine or proof of vaccination for countries that are currently under travel bans, that's a step forward. But if they were to require proof of vaccination for countries that can come here under a testing requirement today, that's a step backwards. One of the interesting studies that was released recently was that a Mayo Clinic study, which was very country specific, but it looked at data in the UK and the US, and it found that with proof of vaccination, proof of testing 72 hours before departure, and then with other protections in place, such as state-of-the-art air filtration systems, continued mask mandates, and then given the infection rates and vaccination rates in both countries, the chances of someone boarding a flight from the UK to the US and being infected with COVID-19 was 1 in 10,000. and the chances of the virus being transmitted on board the aircraft was as low as 1 in 1 million. What I think this shows is that a multi-layered approach can work if it's put in place in reducing risk. And I think the last important point is that vaccine requirements should be temporary, although the system for validating vaccines should be permanent. With any vaccine requirement, we think there should be a clear end game for when those restrictions will be lifted. What are the epidemiological benchmarks? What is the level of risk that we're willing to accept where COVID becomes similar to other communicable diseases, and that vaccine requirement will no longer be put in place. But what we can't do is be caught flat-footed again, where we're trying to build a system during our recovery for proof of vaccination where we're not using paper cards. So what we do this time now is a system that should be able to be turned on in the unfortunate event that we do see another global pandemic. So with that, Mark, I'm going to turn it back over to you for questions.
Eric, that was fantastic. Thanks very much. I am tempted just to ask you a question really about the impact of the Delta variant. I mean, obviously everybody's been talking about it throughout the conference. I mean, those of us who have been involved in these discussions over the last few months, I know you have been, I certainly have, there's kind of been a pre-Delta and a post-Delta kind of dividing line. I mean, before Delta, I was pretty optimistic that we could come up with an international system that we could actually get countries to buy into. Delta's been a real shock and has really scared a lot of policymakers. Is that how you see it as well, or do you actually think that the fundamental issues that we were putting in place that we continue to talk about at this conference can survive new variants such as Delta?
Well, I think that the Delta variant has absolutely swung the pendulum in the direction of vaccine verification and requiring vaccines. And that's not only in the private sector, but it's absolutely for things like travel as well, where I think a lot of the discussions pre-Delta variant were focused on a framework that would include vaccine verification or testing or proof of recovery. But now the real focus seems to be just on proof of vaccination only. So in many ways, I think that's promising that there could be a solution, there could be a pathway to reopen travel if we're going to use vaccine verification. But I also think in many ways it's concerning as well in that we don't have the same type of certainty that we had in the past, and that it shows how quickly things can change when governments are grappling with these policy decisions.